Բարի երեկո սիրելի բարեկամներ։ Այսօրվա մեր թեման է Կալիֆոռնիա հիվանդանոցներու մասին եւ ինչ կնշանակի ցեզի individually եթե ունեք Medicare կամ Obamacare։ Մեր այսօրվա հյուրն է Կալիֆոռնիա հիվանդանոցներու միության ադենապետը պարոն Duane Dauner։
Hi, my name is Dr. Manuel Momjin and I'm practicing at Dignity Health Glendale Memorial Hospital. For common colds, most people don't know when they need to stay home or when they need to go and see the doctor. If you're having fevers for more than 3 days, cough that just doesn't go away, shortness of breath, or chest pain, I would recommend that you go and consult with your doctor.
Հաղորդման հովանավոր Dignity Health Glendale Memorial Hospital. California Hospital Association, Կալիֆոռնիայի հիվանդանոցների միությունը նահանգում գործող առողջապահական հաստատությունների շահերը ներկայացնող գլխավոր կազմակերպությունն է։ Այն ներկայացնում է հիվանդանոցների եւ առողջապահական հաստատությունների հետաքրքրությունները օրենսդրական եւ վարչական գործընթացներում։ Գործելով այս կամ այն օրենսդրական եւ կանոնակարգային փոփոխությունների դեպքում նահանգի առողջապահական ոլորտի բարելավման օգտին։ Կալիֆոռնիայի հիվանդանոցների միությունը բաղկացած է 3 հիմնական մասնաճյուղից։ Հյուսիսային եւ կենտրոնական Կալիֆոռնիայի հիվանդանոցների խորհուրդը, Սան Դիեգո եւ Իմպերիալ շրջանների հիվանդանոցների միությունը եւ Հարավային Կալիֆոռնիայի հիվանդանոցների միությունը։ Կալիֆոռնիայի հիվանդանոցների միությունը Միացյալ Նահանգների առողջապահական ոլորտի խոշորագույն կազմակերպություններից է, որի կազմում են ավելի քան 400 խոշոր հիվանդանոցներ եւ առողջապահական հաստատություններ։ Միության հիմնական նպատակը նահանգի բնակչության համար մատչելի եւ բարձրորակ բուժսպասարկման ապահովումն է։ Այսօր մեր տաղավարում ենք հյուրընկալել Կալիֆոռնիայի հիվանդանոցների միության նախագահ եւ գործադիր տնօրեն Duane Daunerին։ 1985 թվականից ի վեր զբաղեցնելով միության նախագահի եւ գործադիր տնօրենի պաշտոնը, Duane Dauner-ը երկրի առողջապահական ոլորտի գործընթացների ակտիվ մասնակից է եղել եւ ճանաչված է իբրև ոլորտի ամենաբանիմաց ղեկավարներից մեկը։
Մեր հյուրն է California հիվանդանոցներու միության ադենապետը California Hospital Association President and CEO, Baron Duane Dauner. So, Duane Dauner, pleasure to have you on my show. Pleasure to have you on Horizon TV. It's an Armenian-American TV station, and we are having this conversation regarding healthcare in general about California and the nation, particularly what it means to our audience, which is primarily an Armenian-American audience.
Thank you, Mike. It's a pleasure to be here.
Thank you. Let's talk about the latest, which is a very hot topic, and everybody's talking about it, is after so many attempts or so many trials, so to speak, Senate is back again with this new legislation through Graham Cassidy. What does that mean? Can you just simply explain to our audience, number one, what is that legislation? Number two, what's the impact of that legislation to individuals in the state of California?
Okay. It is complicated, but we'll try to reduce it down to a series of words that will be understandable. First of all, back in 2010, when the Democratic majority put through under the so-called acts that they have only a simple majority to get, we call that reconciliation. They passed it in 2010, and it then became implemented in 2014 on a gradual basis, and it's still not all fully implemented. But what that law did was to expand significantly the ability of states to enroll people in Medi-Cal and Medicaid in other states. But that is the federal state program for low-income people. In addition, it created what we call marketplaces for people above 138% of the federal poverty level all the way to 400% of the federal poverty level, and their federal subsidies are given to help people buy coverage. Mm-hmm. And then there was a program also included which allowed for the federal government to subsidize the deductibles and copay requirements for the low-income individuals that were in that marketplace. It was then implemented in 2014. California was the first state in the nation to pass a law implementing that federal law, which is referred to as Obamacare or the Affordable Care Act. And I think when you look at all the states, probably California has been the most successful in implementing that law. More than 4 million people have been added to Medi-Cal in the state.
In California.
In California alone, and 1.5 million are enrolled in that marketplace program through what we call a state exchange. Now,
which is covered California.
Which is covered California.
Covered
yes.
California.
And we're now moving through that program. We find that over the last 7 years, the Republicans, none of whom voted for the bill originally in 2010, wanted to repeal it, and they've campaigned on that basis. They now have a majority, and there's one bill each year called reconciliation that does not require a 60-vote majority in the Senate. And there are only 52 Republicans out of 100 in the Senate, and they can pass it on a simple majority vote. But the deadline is September 30 of each fiscal year.
Which is ending next week.
Next week.
For us.
September 30 is the deadline for a reconciliation bill to be passed that would repeal, replace, or modify the Affordable Care Act for the year ending September 30, 2017. Now, in October, there will be another fiscal year 18 Reconciliation Act, but they're normally not dealt with until after the first of the calendar year. So this is the one opportunity that the Republicans have. The House passed a bill, sent it to the Senate. It was rejected, and nothing has happened, even though they went through 3 different versions over on the Senate side. And everybody thought it was dead. The Congress went home for the August recess, and now they're back, and the Senate has revived its efforts through the Cassidy bill. Now, when we look at Cassidy Graham, we have senators from Louisiana and South Carolina. And most states that did not implement the federal law would benefit from what they developed as an alternative. Texas is by far the greatest beneficiary of this bill. By and large, the blue states, like California and New York, are the loser states, and California loses far more under this Cassidy-Graham proposal than any other state. It's in the billions of dollars.
To the state of California.
To the state of California. And so it is highly significant. Now, what does this new proposal do? It would, for that expanded population group, the roughly 4 million in California, the federal subsidy goes away by 2026. It starts in 2020 and ratchets down, and then in 2026, it's eliminated. For that exchange population through covered California, with the 1.5 million, it expires at the end of 2026. So now we have 2 major programs that have been eliminated, and they're really the cornerstones of the Affordable Care Act. In addition, the tax credits that people obtained under the Affordable Care Act would evaporate. They would no longer be in effect after 2026. So we have a lot of changes that would be proposed, all of which are cuts. Now, when you put that against the backdrop of where the federal government is, you can argue that we have to reduce federal expenditures simply because we're in deficit spending and have been for all of the last 20 years except for 2. And for every dollar that the federal government spends, we're borrowing more than 35 cents. Well, we can't continue to do that forever.
From a global standpoint.
From a global standpoint, we can't survive. However, this bill attacks only health care. And if there's a tax reform bill that turns around and gives tax benefits or reduces the taxes, either on the middle class or the upper class, it doesn't matter, revenues will go down. And so we still haven't gained very much. And health care is too important. It is the most important thing to people, and when they're sick, it's number one, it's the only thing. And so this Senate bill would make those drastic cuts. No changes would occur till 2020. But then in 2020, they're ratcheted down, and then, as I said, in 2026, we fall off the cliff. And by then, it's a loss to California of more than $57 billion a year. I mean,
California cannot afford.
The total general fund budget of California now is only $150 billion.
So 35%.
So it'd be a third of the California budget would be added. That's not going to happen. California can't take on that additional burden. So something has to give. What will it be? It's most likely going to be a reduction in coverage, a reduction in access to care for people that are on those programs, and they will lose their access to health care services. And that means that they're not going to get the preventive care, they're not going to get the episodic care when they need it, and their chronic conditions will get worse. So unfortunately, it's a pathway to lower standards of health in California for this population.
Which is a disaster.
It is a disaster.
We're going to take a short break, and when we come back, we'll talk a little bit more, because I did read also there's elimination of pre-existing conditions, also individual mandates, and all that could be eliminated. So we'll discuss that when we come back.
Okay.
Սիրելի պայգամներ, գաշ տատարեմի հետը պիտի վերաթանակ մեր հայդակները։ Սիրելի պայգամներ, մեր այսօրվա հյուրն է պարոն Duane Daunerը, California Hospital Association President, CEO. Duane, just before the break, we touched base to some of the other provisions of this legislation that's in Senate right now, which is getting rid of pre-existing conditions. I mean, that was the cornerstone of Obamacare or the Affordable Care Act. And also individual mandate that people buy, even though some people were objecting to it, but at least have the coverage necessary, and that reduced the uninsured drastically. So what are your thoughts on those two specific points?
Well, on the first one, on pre-existing conditions, it doesn't actually eliminate the provisions. It allows the states to permit insurance companies to charge more for
I mean, it's effectively the same thing.
And so if you looked at it in the global sense, will people be able to afford much higher premiums when they have pre-existing conditions? And in many cases, the answer is no.
Right.
So they lose the coverage. And the argument on the other side would be, yeah, but if it's really important, they'll provide for it. However, the reality is that if people don't have the money to pay for it, they're not going to pay for it.
The reason people pre-existing condition, you have cancer or other serious ailments, and you couldn't get coverage because it was too expensive,
right.
You couldn't afford it.
Exactly right. Now, on the other point, when we look at all of the items that are in that bill, and we think about cutbacks and things that they have done that are detrimental, and we get to how do you ensure coverage? How do you make sure that people have coverage and that you spread the risk over a large population? The only way you can do that is to mandate that people have coverage.
Have insurance.
Now, we've had a law on the books for decades that people, if they're going to have an automobile, have to have liability insurance.
Right.
And so the idea of mandates is not new in this country. The Affordable Care Act required individuals to have coverage and to small groups to have coverage and employers to provide coverage. So that is called a mandate. This Senate bill eliminates the mandate. Well, if people don't have a requirement to provide them coverage for themselves, or an employer doesn't, then they'll make a judgment based on cost or whatever. They're not going to do it. But when they get sick, then they need it. And so what's the problem here? The problem is you can't spread the risk because the people didn't participate when they were not sick. And if only sick people have insurance, nobody can afford it. So it's a catch-22. Those two provisions clearly would make premiums much higher in the first case, and in the second case, they would make coverage much higher as well, but it takes away the individual responsibility. One of the things about health care is that there's no single silver bullet that is a solution, and nobody is singly responsible for health care. Providers, hospitals, physicians, and many others deliver services. Payers, private and government, pay for services. Individuals consume them. But more than half of health care is delivered because of human behavior. In other words, if people ate properly, exercised properly, didn't abuse tobacco products, didn't abuse alcohol or other substances, and we had the right kind of air and environment for people, we eliminated violence, all of those things, we would reduce healthcare costs by more than 50%. But if people engage in high-risk activity, or they're in an environment they can't get out of, like bad air, and they can't get out of that community, they can't do anything about it, but their health suffers. And so we have to look at health care in a more global sense. And that means, what are the social determinants of people's health? That means income, education, housing, food, transportation, violence in the community. All of those things are factors that cause it. And simply doing what this bill, Cassidy and Graham bill does, ignores all those other things and zeroes in just making cuts. And it is so detrimental to California that the state would be severely disadvantaged, and more importantly than the state are people. Individuals will be hurt.
So this is very, very disturbing to our state and our people, and especially, Armenian Americans, which is part of this great state, will affect dramatically. I mean, the question in my mind, is this a foregone conclusion that Senate is going to vote? Because they tried several times, it failed. What do you think? I mean, if you make a prediction, would this pass between the conservatives and the moderate? I mean, do they have a chance, number one, to pass?
Well, they do, because the states that are most disadvantaged, California, New York, Massachusetts, New Jersey, and so forth, are Democratic. They're blue. And they have 2 Democratic senators.
So it has no impact, basically, because the majority is the Republicans.
The Democrats are going to vote against it no matter what. So there are the 48 that are Democrats, they're going to vote no. The question is, will there be Republicans that stand up and say, we're not going to do this? Senator Rand Paul from Kentucky has already declared he's a no vote for different reasons, but he's declared he's a no vote. And then there are 3 or 4 others, Senator McCain from Arizona, Senator Murkowski from Alaska, and Senator Collins from Maine.
That's already 4.
Yeah, examples. But these other 3 have said, we want it to be a bipartisan process. We want it to be fair to all the states. And this Senate bill doesn't meet either one of those criteria. And so the question is, will these senators be pushed and leveraged into voting for it or not? If they get 50 votes, if only 2 defect from voting for that bill, the vice president would step in and give it the 51st vote, because the vice president is the president of the Senate. And he only votes when there's a tie, to break a tie.
So California, kind of, because we have such a blue state label, our 2 senators are Democrats. I mean, what can California do? Basically, we have no say in it.
Well,
I mean, we're a hostage to what they decide in Washington.
On the Senate side, we have very little influence.
Even though it will affect 4 million Californians.
Yeah, even though, because our two senators are in that 48. On the House side, it's different. We have 14 Republican members of Congress out of 53. And while the state's blue, we do have some districts that are Republican. And we're working right now to educate them on the detrimental effects that this bill would have on Californians and their districts and the residents in their district. And hopefully we will be able to get some of the Republican members of the California delegation to vote no if this bill passes the Senate and gets over to the House. You asked me the question, will it pass the Senate? I think the chances of it passing the Senate are at least 50-50, if not more.
Which is not a good option to be in. But this, you know, the majority leader is a California guy, and it will affect his district. I mean, he should represent his own district as opposed to what the party's line is.
Well, now, on the House side, the majority and the minority leaders are from California.
From California,
very
Nancy
unique.
Pelosi
and Kevin McCarthy on the Republican majority side, Nancy Pelosi on the Democrat minority party side. And frankly, if he is going to maintain his position as the majority leader, he will have to go with the Republican position. He would get kicked out of his position if he didn't. Now, then the question is, for California, is it more important for him to remain as the majority leader, even though he wouldn't be on the same side of this issue as we are? In the big picture, I think that the answer is yes. We're better off keeping him as a majority leader. The other 13, though, we're working really hard to get to go to no if it reaches the House. Several other states, Pennsylvania, Wisconsin, Michigan, Ohio, that are more either kind of red or purple, and they may have one Republican senator and one Democratic senator on the Senate side. They've got several Republicans in the House, and even New York has half a dozen Republicans in the House of Representatives. If those people would stand up and say no, then it could be defeated in the House. But it's an uphill battle in both the Senate and the House.
We're going to take a short break, and
Okay.
when we come back, we'll talk a little bit more. I'm really concerned about our people in California because that's where, you know, majority of our audience is, and I'm a Californian first, so I want to see what's good for California. Սեր պայգամներ գարչ թաթարե մետը պիտի վերաթարնանք այս շատ կարևոր հարցի մասին խոսելու։ Thank you. Ինչպես ասենք, այսօրվա մեր հյուրն է բարոն Duane Dauner, California Hospital Association-ի կամ California Հիվանդանոցների միության ադենաբեդը։ Duane, just before the break, we talked about other states. I mean, what else CHA do? Work with American Hospital Association, AHA, to talk to these various senators or congressional leaders in other areas where we can have some influence. I mean, I know our company is in 15 states, and we can write letters to these senators, especially in Nevada. It's the Heller is one of those guys pushing, and we have 2 hospitals, one in Reno, one in Las Vegas. In Pennsylvania, Ohio, where Republicans have some say. Right. What do you suggest we should do?
Well, the American Hospital Association is leading the nationwide charge on behalf of all states, but we have been in constant communication with 7 or 8 other state associations like CHA for Pennsylvania, Michigan, Wisconsin, and so forth, even Florida, where there's Senator Rubio, a Republican. And they're working hard to convince those senators to vote no, and we have been providing them support, documentation, and advice for the last several weeks, but really intensively for the last week. And hopefully they will be able to convince those people to vote no. Now, Senator Murkowski and Collins and McCain are the ones that voted no to kill it last time. Unfortunately, this week, the governor of Arizona came out endorsing the Cassidy Graham bill. And you know, that it makes no sense, but nevertheless, that's what he did. So it puts Senator McCain in a bind. Alaska and Maine, the other two, if they will stick to their guns and vote no, along with Senator Rand Paul from Kentucky, then we can defeat it. And trying to get one or two of those other senators, for example, in Ohio, the governor, who is a former Republican congressman, he's now Governor John Kasich.
John Kasich.
He is against it, and he's come out very strongly that this will hurt Ohio, and he's opposed. So if Senator Portman from Ohio will stand up, then that would also be a vital vote. I don't know whether he will. And remember, in the whether it's at the federal level or at the state level of any of the 50 states, bills are passed into law based 95% on politics and 5% on policy.
So this is politics.
This is politics.
Even though it may hurt millions of Americans, it's boiling down to politics as opposed to policy, which is a good policy.
Yes, and we're clearly in that ball game right now. And we've got, I mean, you know, when you look at it, you can step back and say, is somebody singularly to blame here? The Democrats in 2010 passed the Affordable Care Act with no Republican votes in support. And if the Republicans do it now, there will be no Democratic votes, Democratic Party votes. Getting back to a bipartisan compromise is where we need to be. And frankly, the Democrats didn't do it in 2010. The Republicans are not doing it in 2017. And you know, we expect our elected officials to work towards the common good together. And right now, that's not happening in Washington, D.C., and it hasn't happened for several years.
Where's our governor, Jerry Brown? I know he's a good friend of yours and good friend of the healthcare industry, but I haven't heard not a single word from him.
Well,
openly saying this is bad for California, it's going to hurt my state.
Yeah, he has
making a case.
He has said that, but and the governor is a strong opponent of this legislation. However, because of the same circumstances we're in, he's a governor and he is a Democrat in a blue state and with 2 blue senators. He doesn't have any influence over the outcome in the Senate either. So essentially, the people in California are in a very weak position to influence the Senate at all, and we've got to really concentrate on the 13 Republicans that we're dealing with now to try to get them to understand the impact on their district and the residents in their district, because the numbers are phenomenal in several of these Republican districts. You know, we have tens of thousands of people that will be taken off the rolls. In fact, hundreds of thousands in some counties.
I was reading the dollar amounts in these districts by each congressperson, and it was phenomenal. I mean, the numbers. So we're basically boiling down to 13 or 14 congressmen that are Republican, that we can influence them. I mean, what is the Hospital Association doing, and what can our audience do in these specific areas, you know, whether in Orange County or in other areas where we have these Republican congressional people?
People that are living in the Republican congressional districts should be emailing, writing, and putting on social media their opposition to this bill and what it's going to do to them. And we know that there are a lot of these people that are going to lose coverage as a result of it. They should be voicing their opinion and saying, this is going to hurt me. It's going to hurt my son, my daughter, my mother or father, or whomever. We have to personalize this and make it real for these members of Congress to understand their district is going to get clobbered by this bill. And hopefully they will see that regardless of political pressure and all the other things, I have to step up and defend my district. And by defending my district, I can't vote for this bill.
Right, because the people in that district elected the person to represent them, and what's good for that district should be done, as opposed to politics, and especially what's going on in between the administration and Congress. I mean, this is it's very disturbing. I mean, even the thought of 4 million people might lose coverage in California. I mean, that's, to me, it's just over 10% of the population will lose coverage. What is the number of people who have Medi-Cal in the state?
14 million people have Medi-Cal coverage in California. 4 million of those were brought on as a result of the Affordable
Care Act. So it's been a, what, 14, if you take 4, is almost 30% increase.
Well, it's been more than that, because if you said 10 and we were going to then add 4 more, that's a 40% increase.
Okay.
Yeah.
We're going to take a short break again,
and
we're going to talk about our last segment about the population and especially this huge number. It's just mind-boggling to me how many people are dependent on these programs in the state, and it's such a vital issue for the state of California and our audience and our people in the state. Սիրելի բարեկամներ, գարշ տաթարեմ է դեպի վերաթարնակ մեր հայդակրին վերջին մասին։ Սիրելի բարեկամներ, մեր այսօրվա հյուրն է բարոն Duane Dauner-ը, Կալիֆոռնիա հիվանդանոցների միության ադենապետը, եւ կխոսենք Medi-Cal-ի եւ Affordable Care Act or Obamacare-ի մասին այսօր։ Duane, just before the break, we talked about the people who are dependent on these programs. I mean, they're real. I mean, as you said, make it more human, as opposed to throwing a number, 4 million. But it's really in each family that needs the coverage, person that needs to go to a hospital or a doctor, and these benefits will be taken away from them. So it's almost, to me, as a healthcare professional for almost 30 years now, I cannot even think, or at least have the thought that, such a large number of people will have no coverage. And we'll clog our ERs, and it'd be a disaster for the state. What are we doing? I mean, why can't the state mobilize and yell and scream as fast as we can in order to say, look, this is a crime, especially these 13 or 14 Republicans. We need to go to their offices and say, you can't do this thing.
That's exactly what we're gearing up, and so are the physicians in the state, the dentists, the nursing homes, and others. There will be, if it passes the Senate next week, let's say that for discussion, it does pass next week, then the House has until September 30. And so there'll be a full court press. In the meantime, we are already meeting with all the Republicans in the House of Representatives. We've given them the data on what the impact is in their district, and there will be local ads on television, on radio, on social media, trying to create the entire corpus of information so that these Republican members of Congress will have a difficult time voting for it because of the detrimental impact on their communities. We're having roundtables with each member of the delegation, and that means conference calls with, have some business people, some hospital people, and some other healthcare providers, and CHA, talking to them about the impact of this. So they're getting not only what we are doing on the advertising front, they're getting, and then free media, earned media as well, they are going to have specific conference calls with people in their district and who will describe the negative impact it's going to have on them.
And I know maybe diplomacy and convincing people is the effective way to get them to your side. And again, maybe I'm advocating something, it's maybe not traditional. Just telling these, congressional people in these districts, look, if you don't vote this way against this bill, you may lose your job, as opposed to listening to your leadership. Because, people in Orange County, and there's 4 Republican congressmen there, or in San Diego, or other districts that have real people, these people will vote. And they will kick you out of office because now you lost their health care benefits. Maybe that's a too drastic approach.
No, that's a reality. When you go back to 2010, some 12.5 Democrat members of Congress lost their seat in November of 2010 because of that vote.
Right.
And that will be the reverse. The merit of that will occur in 2018 November. I think that some of the Republicans clearly stand to lose their seat in Congress if they vote against this bill, if it does pass the Senate and comes back over to the House.
So what should Armenian Americans do? I know we're a small segment of the population at large, and our audience do the same things, basically write letters to their congressman, or go knock on their door saying, hey, Congressman, please help us here.
Yeah. Armenian Americans may be small in numbers, but they're powerful in influence. And so I would encourage everybody listening to this or watching this program to write a letter or an email to their member of Congress, even if it's in a Democratic district, but particularly in Republican districts, to contact them. And if you want, you can go to one of their field offices, district offices, and deliver that transmission, the letter. And getting several people to sign it, again, is important. But communicating with them about it is critically important. I mean, if we don't get it done by the time the House votes, then the game's over.
Yeah, it's over. I mean, we have such a short time.
Short period of time. It's going to be...
September 30th is next week. And if this goes the other way,
right,
we're
people have to do it immediately.
So that's the reason we have you today, to explain to our audience and overall the population, look, this is a very crucial, because healthcare, as you said, it's not like a car or a house, it's your health.
Right.
And if you lose that benefit to be cared for, consequences are huge and very detrimental to the people's life.
They are.
Any less thoughts, Duane? I know we talked about the Affordable Care Act or Obamacare, Medi-Cal, any other healthcare general in the state, and what's your, and you've been in the state over 30 years running hospital association. What are your thoughts about overall what the people in various hospitals and healthcare systems provide on a day-to-day basis?
Well, I started my hospital association career 52 years ago when Medicare was Medicare and Medicaid were enacted. And I spent 10 years in Kansas, 10 years in Missouri, and now 32 years in California. And when I look over that more than a half a decade, Medicare and Medicaid was a big deal. And then in 1972, the Congress passed a lot of health care legislation. In 1982, we got Medicare DRG reimbursement, and that started a chain of probably 50 years, which we're in the middle of now, of changing the incentives under the payment rules. But in 2010, there was a deviation, and it brought in more coverage. And it also picked up on the pay for performance that was being implemented with so-called value-based purchasing. So now we have incentives and penalties about whether we meet certain requirements or whether we meet certain patient satisfaction standards. Those affect reimbursement. I think that's going to become more and more prevalent. Care coordination, managed care is going to increase, which probably means we're going to see more and more consolidation on the payer side as well as on the provider side. But as systems develop and as regional organizations are created, they can't deliver the care unless there's adequate financing. And it doesn't matter what anybody says, whether you pay prospectively, retroactively, or concurrently. If it's inadequate to deliver the care, it's going to fail. And right now, we are facing cuts that will devastate the Medicaid program and the people that are covered, as well as those that are in the marketplace through Covered California. And we cannot afford to let that kind of a step backwards ruin the progress that we've made in California.
Well, Duane, thank you so much for your participation, for explanation. This is such a crucial issue for us here in California as we live in the state, as well as our audience, the Armenian American community, which is, as you said, is active, but also we need to educate them that this is what's going on now, before the end of September, which is, we're almost at the end of that period. Thank you again for being part of the program. Thank you for coming and giving your thoughtfuls.
Thank you.
Սիրելի պայգամներ, այս մեր հայդակիրը գուկա փակման եւ շնորհակալություն գուզեմ հայտնել բարոն Duane Daunerին, որ փաստադրեց Medicali եւ Covered California, which is մեր exchange-ն է, մարդիկ մեր ժողովուրդը ունի շատ անդամներ, as expansion հարկաբես California պրոգրամներում մեջը, ես հուսով եմ, որ քալշապատ երբ որ vote գուկա կոնգրեսի մեջ ասկաչի հաջողուրի եւ գմնա Obama care-ը եւ Covered California-ն դալու համար մեր ժողովրդին իր առողջապահական նպատակները։ Շնորհակալ եմ։
Հաղորդման հովանավոր Dignity Health Glendale Memorial Hospital